So myelodysplastic syndromes are clonal disorder is a form of blood cancer that happen in the bone marrow. Typically, the disease represent as lower counts, so the marrow insufficient to produce cells. And inside the bone marrow, there is a stem cell, and these cells raise to give white blood cells, those help with infection, red blood cells that carry oxygen to the tissue, and a platelets which they help with the bleeding. Now, something happened to the mother cell that we not fully understand today, where these cells start overgrowing inside the bone marrow, and when the pathologists look at them, they look dysplastic, meaning they look funny. So this is how the diagnosis comes, myelodysplastic syndrome. So typically the patient presents with low counts or symptoms from a lower count, and sometimes these get picked up on annual physical exams. So patients show up to their primary care physician, they do blood work, and they notice to have anemia, for example. They get workup for that, everything comes back negative, and then they do bone marrow biopsy, and they found that the diagnosis is myelodysplastic syndromes inside the bone marrow. So in order to diagnose the disease, you really need to do a bone marrow biopsy and aspiration to look under the microscope and identify dysplasia inside the bone marrow. So what we have seen that the outcome of patients with MDS is very heterogeneous. Some of these patients can live for years and others can live for months. Now, identifying their prognosis is very important. It's very important for the patients because it helps them understand their disease and also set up expectations up front. It's also helpful for the treating physicians because all our census guidelines and treatment are based on risk. We typically classify our patients into lower risk of progression to acute myeloid leukemia and lower risk of progression of the disease, and a higher risk of progression of the disease. And the treatment algorithm for these two type of patients is different, as well as the treatment goal. So getting the prognosis accurate is very important. So what we have noted that our current model, in their prediction, there is significant difference between what the model predict for the patient's outcome and what the actual outcome of the patient is. So we are thinking about, can we build a model that can provide personalized prediction or precise prediction that is specific for the patient. And in order to do that, we do clinical data and mutational data from a combined cohort from patients treated at Cleveland Clinic and Munich Leukemia Laboratory in Germany. These are all MDS patients. And we use a machine learning algorithm. So we plugged all this information inside the algorithm. And now everybody talk about machine learning, that it's a black box and we don't know what the algorithm is doing. So in order for us to know what are the features inside, we did what we call it variable importance. In other words, asking the algorithm, what are the important variables that impacted the outcome, and then highlight those variables. And this is very important because number one, it helps us to understand the variables that include in the algorithm to make sure that makes sense clinically, but also learn from the algorithm to identify newer variables that we can't see in traditional statistics. So after we build the model, we have the final models. Now, in order for us to use it in the clinic, we have built a web application where the physician can input the clinical and mutational data, and then the output will be the survival curve that's specific for a patient, as well as survival probability at different time points. We have subsequently also validated the model in a completely independent cohort from Moffitt Cancer Center.